Okay, let's get into this. You've brought a really interesting resource here. We're doing a deep dive into pulmonology, respiratory medicine.
That's right. And the focus is specifically Dr. Atef Ahmed's book. It's called 100 Questions and Answers in Pulmonology for Medical Students.
Right. And what jumps out immediately, even from the title, is the format, isn't it?
Absolutely. The whole thing is structured as questions and answers. It's not your typical textbook layout at all. It's designed very deliberately for learning.
Exactly. So our mission today really is to unpack that.
Yeah.
What makes this Q&A structure tick, especially for something as complex as pulmonology? What are the key takeaways and who's really going to find this useful?
Well, I think the power of this format, it comes down to active learning. You're not just passively absorbing text. You see a question, and it forces you to, engage, to recall information or try and figure out the answer before you see it. The book itself kind of highlights this. It says the structure is really there to boost retention and, yeah, make these really complicated ideas feel a bit more manageable.
Yeah, I can see that. Feels less like being lectured and more like you're in a conversation with the material itself. So what kinds of conversations does this book cover? Because pulmonology is, well, it's huge.
Oh, it's massive. The book covers a really wide range, from the absolute basic, like the physics of how we breathe, all the way up to really advanced treatments.
Right.
You think about the whole field. You've got everything from understanding gas exchange at a microscopic level
Yeah.
to managing chronic stuff like asthma or COPD,
Mhm.
interpreting tricky chest scans, diagnosing infections, lung cancer, sleep medicine, even things like transplantation.
Wow.
And the book specifically lists topics it tackles, like pulmonary function tests, bronchial disorders, pulmonary hypertension, cystic fibrosis. It even gets into pulmonary embolism, critical care aspects. It's broad.
Right. That list alone sounds pretty intense for someone just starting out. So how does the Q&A format actually handle such different kinds of information, like explaining basic physiology versus, say, walking through a diagnosis?
That's a really good point. It seems to use the format quite flexibly. For something basic like physiology, a question might be very direct. Something like, what's the formula for alveolar ventilation?
Yeah.
Just forcing recall.
Okay, straightforward.
But then for a clinical scenario, it might be more like a patient comes in with sudden shortness of breath and chest pain that worsens with breathing. What's your initial diagnostic approach?
I see.
So it's not just asking for a fact, it's prompting you to think through the steps. It guides your clinical reasoning rather than just spitting out information.
Okay, yeah, that makes sense. So it's not just about memorizing answers, it's about applying the knowledge. And the book mentions it uses the latest clinical guidelines too,
Yeah.
right? Which in a field like respiratory medicine, that changes so fast.
That's absolutely crucial. Yeah.
Yeah.
You need current information. And that's probably where the author's background really helps. Dr. Ahmed has years of experience both seeing patients and teaching. So that combination usually means the questions and answers aren't just theoretically sound. They're grounded in what actually happens in the clinic.
Right, in real patient care scenarios.
Exactly. Things you'll likely encounter. It keeps the insights practical.
That makes a big difference. It's not just facts for an exam, it's knowledge you can, actually use. The book seems positioned as great for exams. The Q&A format is perfect for self-testing,
Definitely.
but
Yeah.
also as a kind of rapid reference guide when you're actually doing clinical rotations.
Yes, exactly. Think about being a student or maybe a junior doctor on the ward. You need a quick reminder about differential diagnoses for a certain symptom or how to interpret a PFT result.
Mm-hmm.
Instead of digging through a huge textbook chapter, a targeted question can get you straight to the point.
Right, the core info you need right then.
Yeah. It helps cut through that feeling of information overload and makes the knowledge usable quickly.
So when you boil it all down, whether you're just starting out in medicine or maybe you were more experienced but need a quick refresher, this resource seems to take this huge, complex field and break it down into these manageable question-answer chunks. It makes learning feel less daunting, maybe, and reinforces it through that active recall.
I think so. It offers a clear path through the essential stuff, making sure you get the fundamentals, but also giving you access to the more complex parts of modern respiratory care and hopefully making it stick better.
So just to recap then, we've looked at Dr. Atef Ahmed's 100 Questions and Answers in Pulmonology. It's a comprehensive, up-to-date guide to respiratory medicine, but presented in this very accessible Q&A format, clearly aimed at medical students, residents, clinicians, other healthcare professionals. basically anyone involved in respiratory care.
Yeah, it seems really useful for quick checks, definitely for exam prep, but also just for, deepening your understanding overall.
It really highlights how structuring information differently, like this Q&A approach, can make a big difference.
For sure. It cuts through the usual density of medical text, making complex stuff feel more digestible and hopefully more memorable too.
And when you think about the sheer range of topics this book touches on,
Yeah.
you know, basic science, function tests, asthma, COPD, lung cancer, sleep apnea, critical care, even surgery and transplantation.
Yeah, it's
It
vast.
just
Sure.
underscores how vital and, frankly, how constantly evolving our understanding of respiratory health really is. Kind of leaves you wondering, doesn't it? What are the next big breakthroughs in respiratory care going to be? The advances that will build on this foundational knowledge that resources like this help solidify.